Hi, I'm Steve Feldman, professor here at Wake Forest Baptist Medical Center. I'm discussing our study, long-term adherence to topical psoriasis treatment. Many people with psoriasis have very limited disease and they can be treated with topical therapy. Same is true in other chronic skin diseases, common ones like acne and atopic dermatitis. Not every patient gets well, and we needed to know how well patients use their topical medications. We also wanted to see if having patients report their progress over the internet would improve their use of treatment. We did this because our earlier studies had shown that in the short run, patients didn't use their medications very well and that we could improve their use by having them report their use of treatment. Well, here's what we did. We gave patients jars of fluocinolone ointment and asked them to apply the ointment twice a day. We chose fluocinolone ointment because it's a reasonable psoriasis treatment, a high-potency cortisone, and doesn't have any long-term restrictions, so we could tell people to use it twice a day for the full year. Now, to assess how often they used the medication, we used electronic monitors. These are medication bottle caps that contain computer chips that record the day and time each time patients open and close the bottles. We've used these in past studies. We had patients return for follow-up visits at the usual intervals, at which time we would refill their medication and download the data from the computer chips. We didn't tell patients about the electronic monitoring until the end of the study. In the study, we also randomized patients to either just the standard of care, as I've described, or to report their progress electronically. Well, here are our main findings. First, the use of topical medication was poor. It was bad in the short run and abysmal in the long run. Not one patient used the medicine twice a day for the full year. Towards the end of the year, medication wasn't used at all on about half of the study days. The drug holidays of 7 days or more without taking any medication were quite common. Now, the patients who reported their progress had better adherence, especially in the short run, but even in that group, the adherence continued to drop over time. This study is important to dermatologists and their patients for several reasons. First of all, too often we assume that when we prescribe a treatment, the patient is using it. And then when the disease doesn't seem to be responding, we assume that somehow the disease has become resistant to topical treatment, when the problem is actually poor use of the medication. The whole concept of tachyphylaxis to topical steroids needs to be reconsidered. I think it's not the more you use the medicine, the less it works. It's actually the less you use the medicine, the less it works. Topical treatments can be much more effective if we can get patients to use them. But poor adherence to treatment isn't just our patient's fault. As physicians, we should be putting as much effort into getting patients to use the treatment as we do in making sure we've made the right diagnosis and prescribed the right treatment. Telling patients, here's a prescription, use it twice a day, see you back in 8 to 12 weeks, or maybe even longer, may be the standard way doctors treat patients, but that isn't good medical care. We need to develop, test, and implement more effective strategies that help our patients use their treatment better.